Remember that plant on your windowsill? Or maybe your mom had one? You might have used it once for a burn and then totally forgot about it. Well, guess what? It can actually help calm down joint pain, heal your stomach lining, and make your skin look better, all without any pills. Today I'm going to tell you some stuff you won't find on the label. This plant is sitting in almost every home, but most people have no idea what it can actually do. They cut off a leaf, put it on a burn, and push the pot back to the windowsill, and there it sits, quietly waiting to be taken seriously. In 30 years of medical practice, I've seen simple natural remedies do what expensive medications couldn't. And this plant is one of the very few I recommend to nearly all my patients over 50. Today, I'm going to tell you everything. How it works from the inside out. Why it matters, especially at your age. And, most importantly, how to avoid harming yourself if you're already taking medications. Stay until the end. One part of this video could genuinely change how you feel every single day. So, aloe vera, a plant with nearly 6,000 years of history. The earliest records come from ancient Egypt. They called it the plant of immortality and placed it in the tombs of pharaohs. Not as decoration, as medicine for the journey ahead. The Greeks used it to heal soldiers' wounds. Chinese physicians turned to it for stomach pain and fever. Ayurvedic medicine documented its use more than 2,000 years ago. This is not a trend. This is not a marketing pitch. This is thousands of years of human experience, now confirmed by modern science. And here's what's important to understand right from the start. Inside one ordinary leaf, there are more than 300 biologically active compounds. We'll talk about them in the next part. And once you hear what's actually in there, you'll never look at that plant on your windowsill the same way again. Have you ever cut an aloe leaf in half? If you have, you've seen that clear gel inside. That's exactly where all the value is hidden. That gel is 99% water, but the remaining 1% is a remarkable biochemical laboratory. Inside, there are long-chain sugar molecules called polysaccharides. They calm inflamed tissue and coat the irritated lining of the digestive tract. That's not a metaphor. It's literally a mechanical protective layer from the inside. There are enzymes that help break down fats and sugars in the gut. This matters especially if you feel bloated or heavy after meals. There are vitamins, B complex, vitamin C, vitamin E, and this surprises many people, vitamin B12. The very one that becomes deficient in a large number of adults after 50. There are minerals too: calcium, magnesium, zinc, selenium. All of them support joint function, the nervous system, and immune response. And then there are anthraquinones. I want to flag this specifically, because they are the most debated compounds among physicians when it comes to this plant. We'll come back to that. And it matters a great deal. But the most important thing to understand right now is this. The gel and the juice made from this plant are not the same thing. The difference is significant. I'll explain that when we get to the practical part. For now, remember just one thing. What's sitting on your windowsill is not just a house plant, it's a small pharmacy. And next we're going to look at exactly how it supports your stomach and digestion. Do you know what complaint I hear most often in my practice? Not blood pressure, not joint pain. The stomach. After 50, the digestive system changes. Less stomach acid is produced. The gut lining becomes thinner and more vulnerable. And things that used to pass unnoticed start making themselves known. Heartburn after meals. Bloating. That feeling that your stomach just can't keep up. Sound familiar? This is where the gel from this plant shows one of its most important effects. Its polysaccharides coat the walls of the esophagus and stomach, creating a protective barrier. This reduces irritation and helps ease that burning sensation. Several clinical studies compared aloe gel to common antacid medications. The results were comparable, and the plant-based option came with significantly fewer side effects. There's also research on irritable bowel syndrome. In one study, participants took the gel daily for 4 weeks. The majority reported less bloating and improved regularity. But here's what matters. This doesn't work overnight. The gut lining needs time to recover. A minimum course is 3 to 4 weeks of consistent use, And there's one point I always make clear to my patients. If you've already been diagnosed with gastritis, an ulcer, or acid reflux, please talk to your doctor before starting. Natural remedies don't replace treatment, they support it. Now, remember when I mentioned anthraquinones? Here's why that matters specifically here. They're found not in the GL, but in the outer leaf skin. And if the plant is prepared incorrectly, they can irritate the bowel. We'll cover that in detail when we get to the practical section. Next, we're going to talk about joints. And this is where a lot of people make one very common mistake. After 50, your joints start talking to you every morning. Stiffness, dull aches, that cracking sound on the stairs. Almost everyone over 50 knows exactly what I mean. Inflammation is at the root of most joint problems. And this plant has something genuinely interesting to offer here. It contains compounds that have been shown to suppress the same inflammatory pathways targeted by common anti-inflammatory medications. One of those components is an enzyme that reduces pain signaling in the tissues. That's why applying the gel directly to a sore joint can bring noticeable relief within just a few minutes. But here's where a lot of people go wrong. They apply the gel once and expect a miracle. Topical use provides temporary comfort. For lasting results, you need a consistent, systemic approach, and we'll cover exactly that in the dosage section. There's another angle that almost nobody talks about. Chronic joint inflammation is often connected to the state of your gut. When we support digestion, we're indirectly helping our joints as well. Two processes, quietly linked together. So this plant works on two levels at once. On the outside, it calms inflamed tissue. On the inside, it helps reduce systemic inflammation. Two mechanisms in a single leaf. Next, we're talking about skin. And I'm going to tell you something that might surprise you. Because the most popular way people use aloe for their skin doesn't actually work the way most people think. Aloe and skin. That's probably the most well-known combination in home remedies. A burn, too much sun, a minor cut, and people immediately think of that clear gel on the windowsill. And here, science fully backs up traditional wisdom. The gel has been shown to speed up healing of superficial burns in several controlled studies. On average, wounds close 2 to 3 days faster compared to standard ointments. But here's what's important to understand. This applies to surface-level damage, deep wounds, infected areas, diabetic ulcers. Those require medical attention. The gel is not a substitute for a doctor. Now, when it comes to facial skin, this is where it gets really interesting. Many women over 50 apply fresh gel directly from the leaf to their face every day, and then wonder why the effect only lasts a few minutes before the skin feels dry again. The reason is simple. The gel hydrates, but it doesn't lock moisture in. It works as a carrier, not a barrier. For lasting results, it should be applied under a moisturizer, not instead of one. After 50, the skin loses its ability to retain water much faster than in younger years. And that's exactly where combining the gel with a good moisturizer delivers noticeable results within 2 to 3 weeks. There's another effect that gets less attention. Regular use supports collagen production. It doesn't create collagen from scratch, but it stimulates the skin's own renewal processes. That's a slow result, but a real one. One more thing about skin. If you have psoriasis or eczema, the gel may help reduce itching and irritation. But it's a supportive measure, not a primary treatment. Always use it alongside whatever your doctor has prescribed. Next up, immunity and blood sugar. And here I'm going to say something that most aloe videos deliberately leave out. This is the moment I warned you about. Immunity and blood sugar. Two topics where a lot is said about aloe. But not everything is said. Let's start with immunity. The polysaccharides in the gel do activate certain cells of the immune system. This has been confirmed in laboratory studies. The body begins responding to threats a little faster and more efficiently. But there's an important nuance here. Stimulating the immune system is not always beneficial. If you have an autoimmune condition, rheumatoid arthritis, lupus, multiple sclerosis, additional stimulation may worsen your symptoms. This is serious. Please speak with your doctor before using aloe internally. Now, blood sugar. And here the data is genuinely interesting. Several studies have shown that regular consumption of this plant's juice can help lower fasting glucose levels in people with prediabetes and type 2 diabetes. The exact mechanism isn't fully understood, but the results have been reproduced across multiple studies. That's not a coincidence. However, and this is critically important, if you're already taking medication to lower your blood sugar, adding this remedy may amplify its effect. Your glucose could drop too low. That is dangerous. Please do not make this decision on your own. I'm not saying this to frighten you. I'm saying it because in 30 years of practice, I've seen people develop serious complications from what seemed like harmless natural remedies. Being informed is your best protection. There's one more thing I need to mention. Some studies have flagged a potential impact on liver function with prolonged and uncontrolled use. This applies especially to products made from the whole leaf rather than purified gel. Moderation and awareness. Those are the two words to remember here. In the next part, we finally get to the practical side. How to choose the right plant, how to prepare the gel at home, and what you should absolutely never do. Now, the practical part. What many of you have been waiting for. How to choose the right plant, how to prepare the gel at home, and what mistakes people make that actually cost them their health. Let's start with choosing the plant. Not all aloe is equally beneficial. For therapeutic use, you want a specific variety. Aloe barbadensis Miller. That's the one most commonly called aloe vera. It's very common as a houseplant, thick, fleshy leaves with serrated edges and a slightly grayish coating. The age of the plant matters. Leaves from plants younger than 3 years contain significantly fewer active compounds. The ideal plant is 3 to 5 years old or more. The thicker and fleshier the leaf, the more gel it holds. Now, preparation. Cut a lower or middle leaf at the base. The lower leaves are the most mature. Rinse it and stand it upright, cut side down, for 10 to 15 minutes. This allows the yellow liquid, the latex, to drain out. That's exactly the substance containing the anthraquinones I mentioned earlier. Do not skip this step. The latex is what causes intestinal irritation and unwanted side effects. Once it has drained, slice off the green skin from both sides. What remains is clean, clear gel. You can use this gel immediately. Apply it to the skin or mix it into water. Store it in the refrigerator for no more than 5 to 7 days. Without preservatives, it oxidizes quickly. If you're buying a ready-made product at a store or pharmacy, read the label. The gel should be listed first among the ingredients. If water comes first and aloe appears somewhere in the middle, that's marketing, not medicine. One final point for this section. Never consume products made from the whole leaf that haven't been purified to remove the latex. This includes some inexpensive juices on the market. Always look for the words decolorized or purified on the label. That means the latex has been removed. Next, specific dosages and routines for people over 50. How much, when, and in what form. No fluff, just the facts. The question I hear most often is, how much and how often? People want specifics, and I completely understand that. In most of the studies I've reviewed, internal use of the gel was examined in small amounts, around 2 tablespoons per day. That's not a prescription. That's simply what appears in the scientific literature. What's important to understand is this. Any use is worth discussing with your doctor first, especially if you're over 50 and already taking medications. That's not a formality, that's genuine self-care. In studies on topical application, the gel was applied directly to the affected area once or twice daily. Results were assessed after several weeks of consistent use. As for duration, most clinical protocols ran between 4 and 8 weeks, followed by a break. No serious research has looked at continuous unlimited use as a safe long-term approach. The form of the product also matters. Fresh homemade gel, purified pharmacy gel, and commercial juice are 3 different products with very different concentrations. What's on the label and what's actually inside don't always match. I always say the same thing to my patients. Natural remedies are not toys or candy. They work, and that's exactly why they deserve the same serious approach as anything else you put in your body. Next, contraindications and drug interactions. the most important section of this entire video. Don't go anywhere. This is the section that made it worth staying until now. I mean that seriously. What you're about to hear could protect you from real health complications. Let's start with pregnancy and breastfeeding. Internal use during these periods hasn't been studied enough to be considered safe. That is the clear position of most medical organizations. Kidney disease. There is data suggesting that in people with existing kidney problems, prolonged internal use may place additional strain on the organs. Those with such diagnoses need to be especially careful. Now, medications. And here I need you to listen very closely. Blood thinners, warfarin, and similar drugs. There is evidence that juice from this plant may amplify their effect. This increases the risk of bleeding. That combination requires medical supervision. Blood sugar medications. We already touched on this. To repeat the key point, possible amplification of the drug's effect and the risk of glucose dropping dangerously low. Diuretics. The latex from the plant, that yellow liquid, has a strong laxative effect and can deplete potassium from the body. Combined with diuretics, this creates a risk of dangerous electrolyte imbalance. Heart rhythm medications. Low potassium directly affects cardiac rhythm. That's not a theory. That's basic physiology. I'm listing all of this not to frighten you. I'm listing it because this is exactly the kind of information people don't find on those beautifully designed wellness websites. They write about the benefits. I'm telling you everything. And the main takeaway from this section is very simple. If you take even one medication on a regular basis, speak with your doctor before adding any herbal remedy to your routine. Any remedy, not just this one. The next block is the last one, and in it I'll share something I tell my patients before they leave. Something personal. We've covered a lot of ground today. From ancient Egypt to modern science. From what's inside the leaf to risks that almost nobody talks about openly. And I want to finish not with a dry summary, but with an honest conversation. After 30 years, I've come to understand one thing. The people who live long and live well, they're not the ones taking the most medications. And they're not the ones who reject medicine entirely. They're the ones who know how to ask the right questions and don't stop at beautiful promises. This plant deserves respect, not because it's trendy, but because behind it stands thousands of years of human experience and dozens of serious scientific studies. But respect is not blind faith. It's understanding. Understanding what works, what's exaggerated, and what might be risky specifically for you. That's exactly why I make these videos. Not to sell anything, not to frighten anyone, but so that you can walk into your doctor's office with the right questions and make decisions with full awareness. If this video was helpful, please like it. Not for the numbers, but because it helps people just like you find this kind of information among thousands of empty videos. Leave a comment. Do you have this plant at home? Do you use it? And what did you learn today that you didn't know before? I'm genuinely curious. I read everything. Until the next video, take care of yourself and keep asking the right questions.